Good morning. So my name is Yaneta Aping. I'm the Director of Dietary Services, also a registered dietitian. This is my team. Paul, you all know Paul, clinical dietitian, and then Vaughn, he's a renal dietitian. So this is a program, one of our long-term program, and finally this has reached a milestone in one of our programs that we wanted to instill to improve the service to our patients. So before I go into the training, I'd like to share a policy for this system. The purpose of this program is to provide a system by which patients will continue to receive optimal nutrition in the absence of the normal oral route. Second is to ensure timely feeding is administered to all patients who are at risk of severe malnutrition as evidenced by prolonged poor oral intake, poor appetite, or weight loss to aid in the healing process. In this hospital, closed feeding, which is this system is a closed pump feeding, different from what you're used to, the gravity and bolus feeding. Closed feeding pumps will be used mainly for feeding patients that are on PEG tubes or G tubes, as well as patients on NGT longer than 2 weeks. So this is aimed for long-term feeding patients, or patients that need to be fed via a tube. Gravity feeding will be utilized for acute care patients until transitions to long-term care. So if you have a patient who comes in and need to be fed like just a couple of days, then you still continue with what you're doing right now. But we are also ordering the open system, the bags that can also feed through the the pump. But that bag you have to put in the formula. So we'll come to you when it reaches here. The licensed nurse, the procedure for this is that the licensed nurse will be responsible for ordering the pumps or pump once the doctor signs an order to initiate tube feeding. So this is not something that anybody of your team can do. This is only for the license, including LPNs and RNs. So the licensed charge nurse, whoever will be the charge nurse, will complete the form and call the kitchen for a pump. And the same process is done when you need tubing. So the tubing comes with the pump. Once you order the pump, the tubing will come with the pump. But if you need more tubing, you follow the same process, okay? But the tubing will not be as closely monitored as pump because you're gonna go through a lot of tubings, right? But the pump is. So the dietary staff, after you call them, dietary staff in charge will issue the pump and deliver it to the nursing station at the ward along with the tubing. The charge nurse at the ward will sign the form to acknowledge receipt of the pump. The pump must be returned to dietary when not in use or when patient is discharged. Returning of the pump must be noted in the same form it was issued. So we will keep that form, okay, for you. So when you return the pump, we will note it that it's being returned. For the daily care and maintenance of the pumps, each pump has a serial number by the manufacturer. It has a tag number by LBJ and a pump number by dietary. So these numbers will be issued with the pump. Therefore, these pumps are closely monitored for loss or damage by dietary. It is, sorry, I move a little faster. Okay, so it has this serial number here, serial number by the manufacturer, a tag number by LBJ, and a pump number that will be attached to the clamp, right? When we issue it. So there's going to be a number by dietary. Like for example, this is pump number 14. Okay, but it'll have a tag to come with it when when we issue it.
It will be inside.
It'll be okay. It is the responsibility of the charge nurse to ensure safe handling and inventory of these pumps. So, and it is the responsibility of each ward to clean and maintain the pumps on a daily basis. Okay. So however you want to assign or delegate or arrange your monitoring, that's your thing. But the charge nurse will be the liaison person between nursing and us. Okay. Each ward will identify 2 super users to troubleshoot the pumps when issues arise. Super users will contact dietary if further help is needed. Okay. Dietary is responsible for the deep cleaning of the pumps. So if you know that, and we will try to set up a system to do this on maybe a quarterly basis to examine and, if, for deep cleaning, we will do that, okay? And we'll communicate with you. Each ward will be responsible for the loss of their pumps, and in such case, the charge nurse must report this to the dietary office for further paperwork and documentation. Now, the pump. I just want to orient you to the parts of the Infinity. This is an Infinity feeding pump. The door, this is the door that you open. Number 2 is the wheel. This is the wheel. So the wheel rotates, helps to rotate the tubing. Number 3 is the display. It displays the rate and the volume, okay, and the dose. Number 4 is the tab, so it's up here. Number 5 is the upstream pressure sensor. So that's built in to do the job of moving the tubing. 6 is the air sensor. 7 is downstream pressure sensor. Number 8 is the receptacle for the cassette. This whole thing. And then the keypad down here. Okay. Now, some accessories that come with the pump include the pole clamp. This is the pole clamp. And the charger. So the charger is that whole thing. It comes in this. But when we issue you, we're not going to give you the box. We'll give you just these 3 accessories and the pump in a Ziploc. In a Ziploc. So you will see it. You will see all of these 3 things. Okay, these are the hanging formulas. So the formulas for the pumps comes in a bag of 1 liter. Okay, it's a hanging. You're not gonna use the bottle, because the bottle is for the open bag. Okay, that will come later. These are the spike sets. These are the bags, the hanging bags, the formulas that come in a bag, and it will run through the tubing. So this is a formula for diabetes. Diabetes source AC for diabetes. This is the isosource for non-diabetes patients. This is the complete that made with real fruits and vegetables. So they all come in 1 liter bottle at bags, and it can hang for 48 hours. Yes, so it really helps you save time and effort in trying to, go back and change every time. Okay, this is the sign-in sheet, but did we change that? Yeah. Okay, so that's the sign-in sheet that we will send with the pump, And so we made the change to this sign-in sheet. We put all the serial numbers in there already. So when it comes, you already have the serial number on the sheet, and you just sign your name and put in so some information will come with the sign-in sheet, and you just put in your information, okay? To complete the form. And then the form will return to us. We'll keep the form. Once it's returned, then we'll mark it off. Okay, now directions for use. It's easier because it's lighter. It's easier to screw the clamp on first before you screw it on the pole. So look at the pump. It's very light and easy to handle, huh? So you screw it on, the clamp onto the pump.
You can turn on the light bulb behind you. The switch.
And after that, you just clamp it onto the pole. So after that, you snap in the adapter to the pump. And then plug it in. Okay.
Start.
Okay, so open the door. There's a little
Level.
button down there. You just press it and it'll open. Don't force it. Okay, so you open the door. This is the cassette. This is what you call cassette. You place the cassette or seat the cassette in the pump.
Yeah, so let's say that it's not
Prime.
yet there.
Already prime.
So just hang it here. Just be careful not to poke the rubber tubing. Just push it, pull it
Until it snaps. Yeah. And then close it. Now we're gonna turn to the pump, to the formula, right? To the bag. So you wash your hands first. You do the cleaning handling technique. You wash your hands and shake the bag because it may be settling. Then you hang it up and remove the port.
This one.
So remove the port first. The cap and insert the tip of the SpikeRite Plus connector into the port.
It goes one way, so you just need to push it in and clip it.
So you know you can
It will not
no,
spill
it won't
here.
spill. It won't spill. So you hang it and then spike it and then close it. Okay, some important tips that you can use at room temperature. So you can run it at room temperature and can be used for maximum 48 hours. So no longer than 48 hours. So after 48 hours, the formula is not complete, you dump it. So that's why the rate should be set so that it should be complete by 48 hours. But for some reason that it will not finish by 48 hours, and you can dump it. And there's a new tubing with the formula, with the new bag. Yeah. So do not add medications to it. Now turn the pump on.
That's the tubing. She said the tubing is good for 48 hours.
Yeah.
Okay.
Yeah, you change as soon as you change the bag,
You change with the tubing.
you change the tubing. Yeah.
It will comes always with a tubing, new tubing.
Mm-hmm. Okay. So you press. Did you?
Turn on, boss.
Yeah. Turn it on. Verify all the display segments and audible alarm. And now you start the prime. So for priming, you push and hold the prime key to fill the set with fluid.
Wait, is it gonna go on its own?
Yeah.
No, you have to
Yeah.
push it.
Yeah.
Yeah.
You have to hold it, push and hold
Yeah, it'll prime it.
until
Until it's no bubbles.
There's no bubble.
yeah. And you can see the bubbles, huh?
Yeah, going.
So you're gonna Okay, well,
The process
so that's
usually
the
1 to
prime.
2 minutes.
Yeah,
Okay.
it only take 1-2 minutes. This pump is equipment. So that's auto prime. Okay, we're not gonna talk about the manual prime, because you wanna make your life easier. So, okay, now we set the rate using the plus and minus keys. 42.
Okay, let's say 42. Then in a whole 24 hours, it is around 10:50.
So you're running ahead of me.
Sorry, boss.
Okay, so he was setting the rate first and then dose, and after that you run it. Okay, so can you set for infinity?
Okay, boss.
For continuous feeding, you push the feeding interval
For infinity.
key, yeah, and then set non
For interval, it's just put it on none.
to none.
Because we have continuous, we have bolus, we have intermittent, but we're using continuous, so we will reduce the patient's GRV, the incidence of diarrhea. So let's try to do it on continuous. So just put it none.
Okay.
So when it's none, okay, so let's try to do infinity, boss, right?
Yeah, infinity.
So infinity, okay, goes clear. So it's 0 again. To set in infinity,
You go to the highest.
yeah,
So the
3,000 plus 1. Infinity. So it's infinity.
And that's
So infinity, we can use it especially for our long-term care
Long-term.
patient that we just need to hang it, and because we know the patient will be on PEG for a long time. No need to set the dose. You just hang it in, put the new tubing, and continue.
and change after
And just change the rate if it is needed or not. Just continue it.
Did you say pause?
Not yet.
So you can when you run it, after you run it, if you want to pause because you want to flush or patient wants to go to the bathroom, you can press it again to pause, and then it'll pause. And then after 2 minutes that you haven't gone back to restart it, the machine will tell you. Yeah, so
The
it'll
machine
beep.
will tell you it's running when it's
Okay.
there's a certain run.
It's going around.
Yeah, then when it's paused, it will stop. 2 minutes after, it will alarm. Remind you
Yeah.
that the patient is not feeding.
Mm-hmm. So after you return, you can restart the feeding. But if by some reason that you forgot, then 2 minutes the machine will tell you. Yeah. So you can also see how much the total volume that has been run.
Yeah.
The volume within 24 hours and the volume since it starts. Yeah. But when you start a new feeding, or if you take the pump and use it on any patient, you have to clear. You have to clear the.
The clear is you just put it here, then you just press clear. It will go back to 0. For those, you can also clear. Yeah, 0. Then you can start anew.
So it has a built-in charger, battery, so you can recharge it. But in case that you need to move with the pump, yeah.
We
but-
will
But we recommend that you keep it
keep some
on,
charge.
keep it charged.